New at noon earlier this month, North Mississippi Health Services terminated United Healthcare Medicare Advantage. We want to make sure our viewers understand it's United Healthcare Medicare Advantage. Now, this change affects approximately 17,000 members in the hospital system which is a 24-county service area. And joining us now is Wally Davis, the System Vice President of Payer Strategy and Partnerships. How are you doing, Wally?
Thank you, Tanya. It's a pleasure to be here.
And it's a pleasure to have you here. Why the termination? What happened?
Well, we spent probably well over a year in discussions with United Healthcare about some situations where we were incurring several denials or delays in patient care. And unfortunately, United Healthcare was never able to give us a definitive answer as to why that was occurring. So we began the notification process prior to January 1 about our intent to terminate. And unfortunately, we were not able to reach a resolution.
Now, when it comes to the termination, of course, it's affecting 17,000 members, primarily elderly. What can they do when it comes to critical care?
Well, we would encourage them, number one, to look at their insurance ID card and call United Healthcare Customer Service. And as they seek information on continuing care, very often they may need to seek a prior authorization letter from United Healthcare to continue those services with us. But the UHC customer service team is ready to walk them through that process.
Right. Now, how is it the best way to be able to help someone with Medicare through this?
Well, we encourage them to call 1-800-MEDICARE, specifically talk about the network disruption that they've incurred, specifically ask about their out-of-network benefits, and then they can encourage interaction with their agent or broker as well. And then, of course, go to our website at NMHS.net, and there's quite a bit of information there related to this network termination.
And not only that, too, I think it's important for our viewers to know you are not the only hospital system to sever a relationship with United Healthcare when it comes to the Medicare Advantage program.
No, we're not. Received notice the other day that the University of Alabama Birmingham system is scheduled to terminate in July. There's probably been up to 30 hospital systems across the country as well that have left the United Healthcare Medicare Advantage program. It is important to point out that there are some employer groups in the region that have United Healthcare. They are not impacted by this particular contract termination, so they will still remain in network with North Mississippi Health Services. Okay,
and what about re-enrollment? You wanted to mention something real quick about that.
Right, there could be special enrollment privileges for each member, and they need to touch base with their insurance agent and Medicare as well to see if they may qualify for an opportunity to transition to another Medicare Advantage plan or maybe go back to traditional Medicare before the fall open enrollment.
All right, and before we let you go, I just want to make sure, so North Mississippi Health Systems, you still will help out if there is a critical need?
Absolutely. We'll be glad to do so.
All right, thank you so much there, Wally, for joining us.
All right.
We'll be right back.